Thanks for joining us for That Larimer County Show. We've got experts on the show today from Larimer County's Office on Aging to talk about adult resources for care and help, ARCH, and other programs. I'm Deni LaRue, Larimer County Community Information Manager.
And I'm Neil Gluckman, Assistant County Manager, and we have two fabulous guests today. We have a couple of folks from the Office on Aging, and we have Ruth Long, who is the manager of the Office on Aging here in Larimer County, and we have Linda Rumney, who is the program coordinator of the ARCH program here in Larimer County. And before we begin, a couple of things. The Office on Aging is under the Department of Human Services and works with our senior citizens. Tell us a little bit about Office on Aging and what they do besides playing Canaster and Gin Rumney.
Rumney.
And that's how I remembered our guest's name.
Yes.
So,
Okay. Well, the Office on Aging is actually an area agency on aging. In the state of Colorado, we have 16 area agencies. We receive federal dollars from the Older Americans Act, and we use that money to provide services for seniors in our counties. And of course, we have to do a needs assessment to determine what services are needed, and then we fund those services or we provide them directly. So we use about half of the money that we receive to fund services in the county, and we use the other half to provide direct services. So some of those direct services that we provide are the Long-Term Care Ombudsman Program. The Ombudsman visit all of the long-term care facilities in the county on a regular basis to determine what the residents need and to advocate for them.
Ruth, when you talk about seniors in Larimer County, though, who are you talking about? Who's your audience?
Okay, it's people who are 60 and over. And all of our programs are funded just for that population, with the exception of the ARCH program. And Linda can tell you a little bit more about the age that is covered by ARCH.
So that's the age directly, but then some of your caregiving that you just mentioned, that's also aimed at caregivers who might be taking care of people 60 and over.
And again, the individuals that they're caring for have to be 60, but the caregivers can be any age. And so that's another one of our programs is the Family Caregiver Support Program, and we provide counseling and respite grants for individuals who are providing care for others.
And connect them to a lot of the different resources the caregivers can use in our county that give them the support to keep their loved one in their home and continue to provide that care.
One other question on context for our viewers out there is when we know the age group now we're targeting. So what percentage of Larimer County residents is that?
Currently, it's about 17% of the population of the county is 60 and over. But that's a growing population. So by 2030, which really is only 18 years away, the percentage of the seniors in Larimer County will be up to 23%. So almost a quarter of us will be over 60.
okay, well, I won't reach that then, but how does that feel? How does that compare to the national statistics?
You know, it's just a little bit higher than it's, this is a population trend. I think everybody's heard about the silver tsunami. This is a trend that we are an aging population. And so, but Larimer County is right now really attracting a lot of older adults to come to the county.
Sure.
And so consequently, our population growth is going to be aging a little bit higher than the rest
which is a good thing, and I'm sure that one of the reasons that they come here is because of the publicity and, well, which is based in reality that this is a very good place to be.
That's correct.
Yeah.
And plus we have a lot of services for seniors.
Right.
There are definitely some areas where we have gaps, but the Office on Aging tries to determine what is needed and to provide the services that are needed. In addition to the services that we provide directly, we also fund the Congregate Meals Program, Home Delivered Meals Programs, several transportation programs, in-home services and supports, and and others as well.
We talked about age. Do some of these programs, I assume, also have income guidelines, but the majority of programs, they're open to no matter what?
Actually, the Older Americans Act does not allow us to use income guidelines.
That's a good
and
point.
So any senior, anyone 60 and older, qualifies for our programs. We sometimes collect information about their income, but it's only so that we have that information. It's not to qualify them or disqualify them for our program.
Well, that's good to know.
So we do operate on a donation basis. We ask older adults to make a donation for the services that they receive. And then that money goes back into the program so that it can be provided for additional seniors.
Okay. So we'll get back into this a little later in the program, but just for now, if somebody's tuning in and out, they can get in-depth information on Office on Aging and the services you provide and the resources and the programs right at Larimer County's website.
That's right.
Okay.
Larimer.org/seniors is our part of the website, and the information is available there.
Now, one of the reasons we're here today is as a result of a survey that you took for seniors in Larimer County, and they said they needed more information about this program. So
Yes.
doing this cable program on Channel 14 and other local cable channels helps get the word out about the program.
That's right. We did a survey a year ago that asked seniors. It was sent out to 2,500 seniors in the county, and asked them what their greatest needs were, and it was very specific. So 46% of the respondents to that survey said that it was a problem for them to get information about services for seniors. So we have long recognized that that is probably one of the greatest needs of seniors, is simply information. And that's kind of how this ARCH program came into being.
Okay, well, let's jump into that then.
So why don't you tell us a little bit about ARCH, what the acronym stands for, which I think we already covered, but let's do it again, and give us kind of a brief overview.
Okay. Well, ARCH is Adult Resources for Care and Help. It actually, at the federal level, is called, and we all love acronyms, ADRC, which is Aging and Disability Resource Centers. And in Colorado, we call it ARCH, Adult Resources for Care and Help. And it started at the federal level. As Ruth said, the senior population is growing. And Medicare and Medicaid really can't support, as people age, for everyone just to be put into an institution, a nursing home, or assisted living. That funding is getting tighter and tighter.
And it's expensive.
And it's very expensive. That would be our top level of care, would be our skilled nursing facility. So the government is looking at what other resources are available to keep people as independent as possible in the community in their own home. And that doesn't mean that people still won't go to nursing homes or assisted living, but when they don't quite need that level of care, how can we make resources go the furthest to take care of our seniors? The ARCH program, unlike other Office on Aging programs, does serve the population 18 to 59. We have some grant funding. And right now, ARCH is not funded through Older Americans Act funding, so that's why we have that ability to serve people 18 and over. So the way we look at ARCH is it's this big umbrella, and it's the thought of there's no wrong entry. Come to ARCH, it's a good place to start. The system is very overwhelming for people. Something that sounds simple to those of us that work in this, have this line of work, it's confusing for us, but in the general public, it's like that people don't even know where to start, what's available. What can I private pay? What does public money pay for? What does Medicare pay for? What does Medicaid pay for? What's the difference between Medicare and Medicaid? Very, very confusing. So ARCH is a place to call, and I can help people sort out what are their options so that they can make informed decisions.
I would guess, and correct me if I'm wrong, but it would seem to me that the bulk of the population would prefer to stay as independent as possible.
I think most people, when you just talk to people, they want to age in place is what the term you'll hear people say. And so they like to stay in their own environment. People do better in their own environment and only have to move to a assisted or nursing home if their care needs become higher than what can be supported in the home. But there are a lot of supports that can come into your home. There's a lot of in-home care agencies that can come in and start with just a couple hours a week and go all the way up to 24/7 care in the home. And of course, resources could be an issue at that point because that is a very costly to bring services in for 24/7. So helping people know, what are the baby steps to start when we start seeing a loved one, a neighbor that's struggling. And we all have neighbors that we need to look out for. We have
regardless of
whether you're related to them, whether you really know them, look out for your neighbors.
Snow shoveling.
Snow shoveling, particularly this time of year.
Yeah.
But your loved ones, your family, people that are friends, when you start seeing them struggling, knowing what you can do to help, ARCH is a place to start.
Walk through a scenario. Suppose
Exactly.
I'm a older child of a senior adult who may be now, appears to me that they're having some problems getting around their home. They're having problems maybe even knowing when to cook for themselves, dressing, whatever. I call you up, right?
Mm-hmm.
Okay, so then what happens?
Well, one of the first things to look at is resources. What assets does that person have? And if they have even limited resources, what's the best way we can stretch those and keep that person in the home with the support that they need? What level, what's the lowest level that we can do to keep that person independent in their home? And there's a lot of in-home care agencies that have different services, everything from laundry, light housekeeping, meal preparation, assistance with showering and dressing. We have Lifeline when people are home alone if they fall, for alerting like a 911. They can wear it on their wrist. They can wear a pendant.
So if I understand it, what you're doing is there's these resources out there in the county.
Mm-hmm.
So rather than I'm trying to search and I don't even know the first step, you are helping me identify the resources there so that I can then use them or at least connect up with them. Is that?
And ARCH kind of has almost two levels. There's the information and assistance, and I get a lot of those calls that can really be handled with one phone call or maybe a series of 2 or 3 phone calls. I always tell people there's no such thing as a silly question. Call as many times as you have to, and we'll walk through this together. Many times I get calls from adult children, and 1 or 2 phone calls, they can kind of get a roadmap, and they can then make the phone calls themselves and get a good feel for what's available in our county. And luckily, our county does have a lot of good resources. And just finding those sometimes is the difficult piece. And I can kind of help with that because it is overwhelming to make 40 phone calls. So after we kind of come up with that care need, then looking at which avenue, which direction do we want to go to save you as the adult child a lot of time. So if it's just simply information and assistance, then a couple phone calls and I can kind of set people in the right direction so that they can make informed choices. But then there's always those people that it's a little more in depth or it's a long distance situation. I'm talking to, adult children that are out of state. I go and sit at somebody's kitchen table or at a coffee shop, wherever they're comfortable, and sit down with them. And that's more what we call options counseling or short-term case management. And it's a little more in depth than just that phone call. And I actually sit down and, what does the person that needs the care help? What do they really want to do?
So you talk to that person.
Talk to that person, talk to family. It can be a group situation where mom and dad who need the help, adult children, neighbors, that whole caring unit is sitting at the table together, and we make a roadmap, action plan. You can use various terms for that. And then help them through those steps. What I find, and I think most people that give help to people, once you give more than a couple referrals, that's pretty overwhelming. If you're telling people to make 5 phone calls, that's a lot to expect somebody, even somebody that's not in crisis, to do.
Right.
So let's break it down. Let's do 1 call. Let's do 2 calls. I'll do some, you do some, and it's kind of a partnership. And we just take the baby steps and figure out, what we need to do.
Well, it's not only overwhelming, it's emotional, too.
Oh, yeah. And there's some grief involved when we watch our loved ones age. you're grieving for the loss of
Right.
that independence that
Yeah.
they had.
Right.
I would guess there are some challenges too. One that comes to mind for me, and correct me again on this one, is that some people just are not used to having somebody come into their home.
It's very intimidating.
Yeah. And so getting over that hurdle, if necessary, is probably a big step.
It's a very big step. A lot of resistance from people. So that's why sometimes we start out with just a few hours a week. And maybe that person doesn't provide any hands-on direct assistance at first. Maybe it's more somebody coming in and preparing a meal. And that's a little less intimidating than somebody giving personal care. And then building that relationship with that care provider that's coming into the home. And it takes some time, and matching people correctly, personalities and desires. And there's a lot of different aspects to finding somebody that come into the home than just making a phone call, hey, send somebody.
It's a relationship that develops.
Yes.
And it's also, I think, really important to always offer the individuals choices, because if they have had an opportunity to choose between either, this might be the time to move into assisted living or a nursing home, or if you can stay at home, but you have to be willing to have someone come in and help. If they've had some say in that, they're much more likely to buy into the services that they would be receiving. So it's important to offer choice, and I think that's one of the things that Linda does, is to always try to give them all the options that are available to them.
Because there's times I work with somebody and they feel very isolated in their home. Maybe their spouse recently died and they're a fairly social person. And that person wants to move to assisted living because there's the social aspect of assisted living that can offer, that maybe being in your own home in the community, you would feel isolated if you no longer drive or don't have friends or neighbors that are coming over. So really talking to that individual is so important as to what they want to do. And then it's a decision that family can help them with. And as I'm kind of there as their guide, so that they have all the information, so they really can make a good informed choice rather than just picking up the phone book or making, their neighbor suggested they go here or there, and not knowing what all the options are.
A lot of times families, especially if they're living out of state or at a distance, feel so much anxiety for their parents. They just want the problem solved as quickly as possible. And they may not want to take the time to look at all of the options. And so that's they can't do all that research from the distance, whereas, Linda can provide them with that information. So it's very helpful to families.
I remember one of the people in your department, Lynette McGowan, who works with the caregiving piece, always suggests during the holidays, when people are home for the holidays from out of state, it's maybe a great time just to maybe look at some resources for aging parents, or get some of those hands-on things done that they can do when they're in the area, and that's a certain amount of the population. I would think that this is a conversation that people ought to be having with their family and their kids, and just talking about the future. What is it we want? What is it we don't want? And we're all taught to do that with all kinds of stuff. Let us know in advance what your thinking is, so that we don't get in crisis first and then have to decide.
And Ruth made a kind of important point that I want to plug all the Office on Aging, or sometimes they're called area on aging, or whatever they are across the country, and I don't know how many there are, but if you're, an adult child living here and your parent is somewhere else, I would really, stress to call their Office on Aging, no matter where it is, and they will help out.
Yes.
You want to talk about that? Because I don't know if there's a network or it's just
There is a network, and so, there are 16 area agencies here in Colorado. We're divided by regions. I don't know the number of the number throughout the United States, but every area, every region, every county, city has an area agency on aging, and so you can go anywhere and get that the information about who to contact, where your parents are, what resources are available, and they can give you that information.
And I can tell you, having the direct experience, they're all excellent that I've worked with throughout the country. They are very good.
So. That's what we're there for.
Well, let me ask a question. I was thinking about this the other day, is that many people remember the show The Golden Girls, where 5 senior women decided to live together, share resources, and
I never saw the show, but
so when we talk about independent living, are we seeing more of that kind of collaboration? Is that something that's happening or not, where people are sort of sharing the household and the household costs and as they age, but yet they aren't wanting to live alone?
I haven't actually seen a lot of that with the people I'm working with, but interestingly enough, I hear a lot of people that work in this field talking about doing that. So I think that is something that we will see more, because people can compensate for each other. If somebody has a cognitive decline and they can no longer do certain things, and then another person that they live with can still drive, but they can't do other things. We all have strengths and we all have weaknesses, and so living with people where you can draw on each other's strengths and help people that don't have the same strengths you do, I think is a wonderful idea. I don't see that happening a lot.
senior communes that we're talking
Yeah.
about.
Yeah, yeah. I mean,
Well, the thinking is, I guess, that too, that as you mentioned the silver tsunami earlier, there are so many people who are aging, and as you mentioned, the resources are limited. So there might have to be some other options for, especially independent living, to accommodate.
Well, and
that.
I think
don't
that
know.
one thing that we probably will be seeing, and we already are really, is that the baby boomers, as we baby boomers start aging, baby boomers are very independent and don't want to even admit that we are aging. And so, for example, with our congregate meals programs, we found that the baby boomers who are now 65 are not using those programs as they retire. They want to stay as independent as long as possible. And so we probably aren't going to see that population really start utilizing these services until they're in their 70s. And so, but they have different values, so they may be looking at different options, and we have to really start being creative about what are the different options for services that older adults will want to receive 10 years from now, because it might be different than it is now.
It's probably going to hit hard because, as you say, they're in their 60s, late 60s, maybe even early 70s now. They're not asking for it, but there's going to be that large number that's going to hit some type of threshold, and they are going to be needing those services.
Exactly.
and it's never like you pointed out, it's never too soon to start planning. I mean, it's better to be proactive than reactive, and when you're in crisis, you can't make good decisions. And sometimes the decision making is taken out of your hands. It's boom, what's available, and you just that's where you end up in that situation. And so to start planning early, but again, the baby boomers don't even want to think that way. They don't want to plan, and we need to. So
me?
it's
We're going to be healthy forever.
yeah, it should be real non-threatening. It's not like you're forced to do anything. You make the phone call, you kind of get the information, you can start processing it, knowing what is out there, and start making those plans before you really need it. It's then I see a better outcome for people, and they feel more in control. People like to feel that they still are in control, even if they're some of their strengths are gone. They still need to feel in control.
I think a number of people like me were getting the direct experience through our parents. And even though we're up there in age, and you're right, we don't think we're old, we're seeing what it is like and what we do need to do and what we do need to plan for ourselves.
Right.
How long has Arch been around?
Let's see. Colorado got their first grant, and Larimer County was the pilot, and I want to say it was 2005.
It was 2005. We applied for, well, I should say the state of Colorado applied for the ADRC grant, which is an Aging and Disability Resource Centers, and they were funded in 2005, and Larimer County was the pilot site for this program.
Okay.
So it's now expanded.
I think we have 9 sites in Colorado now.
Yes.
And it's still expanding. It will eventually be throughout the whole state. And although it's just grant funded now, I think people are seeing the value in helping people understand the system and find those resources and find the best use of resources, their own and public resources.
And that individual needs.
Mm-hmm.
We have about a minute left, a little over a minute, where we want to say thank you, but we also want to make sure that people know where they can get information. So you have various literature available. You have your Office on Aging Resource Guide, which is something that comes out every year.
Yes.
And all these are online, is that right?
They're all online, and the resource guide is very good. It's updated every year. It's accurate information. Can't stress enough what a great guide that is, and that can be accessed online.
They can access it online, and is it available?
Or we can mail it. You can call our office. We're happy to mail out a hard copy.
Okay.
Usually the new guide comes out every September, so this is a fairly new guide for this year. And hard copy available. You can get it online at the larimer.org/seniors.
Let's say there's an organization out there that would like you to come and talk to them about this program. Is that something that you do as well?
Yeah, we're happy to come out and do, a short 15-minute up to an hour presentation on the resources and what the Office on Aging can provide.
Okay, that's great.
And we can also provide information about the resources in Larimer County, because not all the providers know about the referrals that they can make. And so we can do that as well.
And you work with United Way 211.
Yes, we do.
Right?
One of our partners.
Let's plug that for just a
Yes,
second.
they're an important partner with the ARCH program, because they are also available to provide information, general information about services for seniors in Larimer County. When it gets more complicated and people need more assistance, that's when they will refer to ARCH.
Okay, that's great. And that's just dialing 211.
Exactly.
Okay, that's good to know. Well, I want to say thank you so much for being here today, Ruth Long.
Thank you.
Thank you for having us.
And Linda Rumney, thank you for being here. And any last parting thoughts, Neil, on this topic?
This is very interesting. The hour went very quick.
Yes, it went very quick. And it's an important issue, I think. And I know you guys get a ton of calls, don't you, at your office?
And
We
you and I
do.
will be calling fairly
Shortly.
soon. Yes.
No, thank you so much for being here today.
Thank you.
And thanks for joining us for that Larimer County show. You know, Neil, coming up in the new year, we're going to have Laurel Cuban on talking about financial literacy.
Right. Laurel Cuban is our Director of Extension Services.
Yeah, and that's an important one too. I mean, getting to understand how finances work and the intricacies will really help people to, have
Especially
balance.
now. I mean, we're all going through some issues, in terms of how the economy is going. So this will be very timely.
Very timely. So we'll look forward to that. Thanks again for joining us for that Larimer County show.